Hi everyone, welcome to our Empower Healthcare webinar for today. My name is Cara. I'm going to get started. We're just after 1 o'clock, so thank you all so much for joining us. I'm really looking forward to sharing this with you today, something I'm really interested in and passionate about. So I'm going to be presenting on food and mood and nutritional psychiatry. Firstly, I'd just like to do an acknowledgement of country. So in the spirit of reconciliation, Empower Healthcare acknowledges the traditional custodians of the country throughout Australia and their connections to land, sea and community. We pay our respect to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander people today. My agenda for today, I'm going to tell you about nutritional psychiatry, brain health and mental health, some Australian statistics, things that impact our mental health and our brain health, how nutrition plays a role, nutritional psychiatry in practice, and then tied all together, telling you a bit about our services here at Empower Healthcare. And there'll be time for some questions at the end. So before I get into all of that, a little bit about me. So I'm the dietitian team lead here at Empower Healthcare for our national team of dietitians. I have been a dietitian for over 10 years, working across the healthcare continuum, majority of that being with older Australians. And I currently work a lot as well with NDIS participants in the community. There's some happy snaps there of myself and my family. So I'm busy out of work as well with my 3 daughters. And there's us in one of our favorite places in Vietnam. Alrighty, so nutritional psychiatry. So the definition of that is that it's the practice of using food and food supplements to treat mental health disorders. So in today's presentation, I'm going to focus on food rather than the supplement side of things, as there is really strong evidence in using food for this purpose. And I'll share some of those studies with you today. So mental health and brain health. The two are interconnected, and I like to think of brain health as the hardware of the computer and mental health as the software. And in terms of those two today, I'm going to focus on depression and dementia. So first, I think it's really important to mention how much of an issue both poor diets and mental ill health have on us as a global population. So according to a 2020 large-scale study on global burden of disease, poor diets and conditions that are strongly linked with poor diets, so things like high blood pressure, were found to be in the top 6 risk factors for early death. The study also found that globally we don't eat enough healthy foods, so things like whole grains, fruits, vegetables, legumes, nuts and seeds, and we eat too many unhealthy foods, so highly processed foods, things with lots of added sugar and salt. So we have known for quite a long time that what we eat impacts our physical health, but it's been really in the last 15 years that research has been emerging showing that what we eat impacts our mental health, so not just our physical health. I'll be talking through some of that today. Sorry, jump forward there. Alrighty, so as I've just mentioned, mental ill health has a huge impact globally. So in Australia, it's said that 43% of Australian adults or people aged 16 to 85 are estimated to have experienced a mental disorder at some point in their life. And we know as well that people living with mental illness are more likely to develop physical illness and also have a lower life expectancy than those without mental illnesses. In terms of depression, according to the World Health Organization, it affects more than 300 million people globally. And the global cost of that is huge. So 1 trillion US per year. And I think in terms of depression specifically, we would probably all, be aware of someone, know someone personally who has had difficulty accessing the right support for that. And we can probably all, relate to the impact that the COVID-19 pandemic has had on accessing that support as well. It was found that just last year, the demand for psychological services had increased so much throughout the pandemic, and 3 out of 4 psychologists now have wait lists. So can be really tricky accessing the supports that people need. Dementia as well, as I'm sure so many of you would be aware, it's really highly prevalent. So we're getting up near that 500,000, over 400,000 people in Australia in 2023 living with dementia. So what are some of the things that influence our mental health and our brain health? So we've got our genetics, our genes. Then we've got individual psychological factors. So that can be things like our own personal resilience, our self-esteem, optimism, and our own self-efficacy. There's also environmental factors that have an impact. So particularly in early life, things like trauma, violence, abuse or neglect, as well as parental mental health. We've got social factors having an impact. So things like differences in status, in our economic situations, in education, as well as differences in access to care and supports. And then the last one I've got there, and I've highlighted it, that's our lifestyle factors that influence mental health and brain health. So that includes diet, alcohol and other substance use, physical inactivity, and poor sleep. So I think that's a really important one to highlight, because those lifestyle factors are ones that are modifiable. So we can't do a lot about our genetics, things that we might have been exposed to in earlier life. But diet is really key to focus on for both prevention and treatment, because it is modifiable. So to dive into the link between what we eat, our gut, and our brain, there's 4 key elements that I'd like to talk through today. So the first one is physical changes that are happening in our brain. The second is damage to our cells, also known as oxidation. The third is inflammation, and the fourth is our gut microorganisms. So that first one there, physical changes in our brain. So in our brains, there's this really key structure called the hippocampus, and you can see it there highlighted in red. So it has several important functions, some of those being regulating our emotions, motivation, playing a really important role in learning and memory. And it's known that diet has a direct impact on hippocampus size. So shrinkage of that part of the brain is present in Alzheimer's disease. And as I said, diet has a direct impact on the size, and that's really interesting when you think of the functions that it has, so learning, memory, those sorts of things. So research has linked an unhealthy Western diet, that highly processed, high added sugar, added salt, with a smaller hippocampus size. And that has been found independent of other variables that might have a role to play. So things like I mentioned, like socioeconomic status or education or physical health conditions. So as well on that, those physical changes in the brain, unhealthy diets have also been found to have an impact on brain plasticity. So that is the ability of our brain to make new neural connections. So we know that as we age, we lose brain neurons, and we lose them even more rapidly in Alzheimer's disease. So the body having the ability to make new neural connections is really important if we think about moderating some of that cognitive decline that can happen in later life or with dementia. So the second key thing there was cell damage or oxidation. So we know in conditions like depression, there's high levels of oxidative stress in the body and circulating free radicals, and they are what damages cells. They can accelerate cell damage, including those brain neurons. So that old saying, eat the rainbow, is really holds true and really important here, because nutritious diets that have a really high variety of colourful, different coloured plant foods, like from fruits and vegetables, they deliver a wide variety of antioxidants, which can reduce that oxidative stress and that cell damage. So the third one there was inflammation. So inflammation, many states across the mental health continuum, so including depression, are known to be linked to systemic or whole body inflammation. And it's not like a raging infection that you might need to be in bed or in hospital for, but it's chronic low-grade inflammation, that chronic activation of the body's immune system. And as I said, depression has been linked with that, and it can also, that chronic inflammation can also increase someone's risk of developing depression as well as hinder recovery. And interestingly, there's now this developing evidence that inflammation is being seen to be linked to cognitive decline. So our Western style diets do have a pro-inflammatory impact on the body. So those high in processed meats, foods with lots of added sugar, salt, and unhealthy fats. So those Western style diets, pro-inflammatory diets, have consistently been shown to be linked to increased risk for many physical diseases like cardiovascular disease, diabetes, some cancers, as well as common mental disorders, including depression, anxiety, and dementia. So the fourth key thing there was talking about our gut microorganisms. So the gut microorganisms living in our gut that colonize there is collectively known as the gut microbiota. And everyone has their own unique population, and we've got trillions of them. So said to be 30 to 400 trillion living in our gut. So links have been established with our gut microbiota, our brain health, our immune system, autoimmune disorders, and our metabolism. And I don't have the time today to go into all of those different studies, but there's one I'd just like to highlight where this was first discovered. So there was an experiment where they bred mice in a completely sterile environment. So they had, you know, much less exposure to a whole range of things, which meant the colonization in their gut was much less varied, lower numbers in their gut microbiota. And what they found was these sterile mice showed altered reactions to social situations, to stress, and to learning, as well as differences in their physical brain structure. So that gut microbiota is really having a key role in our brain. And it's said that a diverse microbiota is a healthy one. So consuming a really wide variety of healthy foods, particularly foods that are high in fiber, contributes to a varied and abundant gut microbiota. And we can see here how our gut microbiota links to our immune system. So at the bottom left there, we've got a little diagram of what would be happening with a high fiber diet. So we've got a high concentration of all those different microorganisms, and some of those work to produce this nice thick mucus layer that protects our gut lining. And you can see it there in yellow. So that nice healthy mucus layer that protects from those little green pathogens getting into our cells and into our bloodstream, trying to make us sick and cause inflammation. So that's with our really varied and abundant microorganisms. On the right-hand side, we've got what would happen in a low fiber diet. So there's a lower number of those microorganisms, a lower variety as well. They're not making that nice thick protective mucus layer, and then it's much easier for those pathogens to get into our cells and our bloodstream and trigger that inflammation response. So diets high in fiber, so from things like whole grains, vegetables, fruits, legumes, lentils, seeds, and nuts have been shown in this way to support our immune function. And as I mentioned, you know, a really diverse variety of high fiber foods helps our gut microbiome, our gut microbiota function the best way it can. So just touching again there on those high fiber diets. So there's some examples there. So the grains, quinoa, rice, wheat, rye, barley, a whole different variety is what's best. Fruits, vegetables, nuts and seeds. What a high fiber diet does in our body is promotes a increased number and variety of those gut microorganisms, supports our immunity, impacts the mucosal immune function, and it influences our gut microbiota to produce that inflammation reducing substance. And our dietitians really, are able to work with people on implementing these things in their unique circumstances. So whether it's in, their specific dietary needs, they might need a special diet or have allergies or, different cooking conditions or all sorts of things, that we can really tailor this recommended high fiber diet to the individual. Another key nutrient that is really important to touch on is omega-3 polyunsaturated fats. So they're said to be one of the healthy fats that we can find in food. And they're in high concentration in oily fish like salmon, sardines, mackerel is a really good one, as well as walnuts, chia seeds, tofu, flaxseed, linseed, canola oil is another really good source. So what these omega-3 fats do is they can help promote that neurogenesis, so that creating new cells in the hippocampus, in that region of the brain. They can reduce inflammation, and in doing those two things, contribute to improved brain health and function. So I'd like to touch on now this really interesting, really important study that was done in Melbourne, and it's called the SMILES trial, which stands for Supporting the Modification of Lifestyle in Lowered Emotional States. It was a partnership between Deakin University and the Food and Mood Centre, and it was the first randomised control trial to confirm a causal relationship between higher intakes of fruit, vegetables, whole grains, fish, and as well as lower intakes of processed foods being consistently associated with better mental health outcomes. So it was, randomized control trial, really great quality research. And what they did in that study, they had a dietary intervention group, and then they had a social support group. And the dietary intervention group worked with a dietitian, and they had tailored advice to improve their diet. And they wanted to make sure that if they saw improvement in that group, it wasn't just because they had had some social interaction. So they had their social support group that received that social interaction instead of the dietary modification. And the findings were really profound. So after just 12 weeks of intervention, that dietary intervention group did show greater improvements in mental health outcomes compared to the social support group. And the outcomes were so good for some that, in fact, 32% of participants achieved full remission, meaning they were no longer considered depressed. So the people in the trial all had clinically diagnosed depression, and 32% of that dietary intervention group achieved remission. And the results they found, it was really causal. So the people who improved their diets the most also had the biggest improvement in their depressive symptoms. And important to note as well that there was no weight change in either group. It was not a weight loss diet. It was focusing on improving diet quality and improving nutritional variety. And there's a little pictorial there of what the type of diet was. So it was focusing on a modified Mediterranean diet. And you can see down the bottom there in the dark green, those are all the things that were recommended every day. So whole grains, fruits, vegetables, some dairy, olive oil every day, nuts every day. And then several times a week above that was legumes, lentils, a few times a week red meat, fish, and extras or those sort of discretionary foods were really kept for special occasions. So I'd like to just highlight now how, all of this research is really coming together and being recognised, not just in Australia, but throughout the world with clinical practice guidelines. So this is just a snippet from our Australian clinical practice guidelines in mood disorders. And this is the foundations of treatment. So at the bottom there, the first thing is lifestyle changes. So that includes smoking cessation, limiting alcohol and other substances, exercise, sleep, and a healthy diet. So what they're saying is this healthy diet and those other lifestyle changes, they are the absolute, the bare minimum. That's the foundation of treating mood disorders, and then you build from there. So we get that right and then build from there. So perhaps you're wondering, what does this mean for your clients? Maybe you've got someone in mind that you might think of could benefit from this sort of dietary interventions. So I think it's important, as I mentioned earlier, that diet really needs to be considered in prevention as well as treatment. So if you think about maybe some of those clients you might have that maybe have early stage dementia or early cognitive decline, and I've talked about how improving diet can help to moderate some of that in later life, as well as those clients who maybe have low mood or diagnosed depression. It's really clear, it's evident that improving diet can help with that condition as well. So a bit about Empower Healthcare overall. So our multidisciplinary teams have all of these services across Australia. So we're in Victoria, New South Wales, Queensland, and Western Australia. And the services in each region do vary. So if you head to our website there, you can see our service coverage maps. Dietetics is offered in Victoria, Queensland, and WA in person, but also telehealth anywhere, which we do really well in dietetics. Also on our website, you can find all in one place our referral form. So all the disciplines can be referred on the one form. You can request our wait lists or our rate cards. And that is everything I had to go through today. Did anybody have any questions? At the moment? Yeah, you can type them into the chat box if you'd like. And if you'd like to type a question, that's something that we can get back to you via email after the presentation as well.
There's a person here who's put their hand up, so shall I allow them to
Well, I've got some questions there. Someone's just stated that they missed some of the session. So the presentation will be uploaded onto our YouTube channel, which will be up there tomorrow. So you'll be able to watch the whole presentation again. The next question, how difficult is it to change your microbiome? That's a really good question. I think that in some of these studies, the SMILES trial that I did talk about, that was 12 weeks and they saw huge improvements. But there has been studies that have shown improvements in, as little as, there was one study actually talking about university students, and they got them to just swap one meal in their day. They swapped their breakfast for a really high sugar, highly processed breakfast. And they saw changes in their mood over a period of 2 to 3 weeks. So the changes can happen quite quickly. So yeah, I hope that sort of answers it a bit. I don't have more concrete, but yeah, definitely you can change it quite quickly. And the important thing is, I'd just like to mention as well, you can get lots of probiotics and prebiotics. If you put those gut bacteria, those good gut bacteria into your gut, if they're not fed high fiber, healthy diets, they'll die off. So it's not really a quick fix. You've got to sort of maintain those healthy changes because there can be a flux and, things can change quite quickly, as I said. Alrighty. I think I've answered the question about the presentation. There's a question there about research for Parkinson's disease. I think, Chris, thank you so much for that question. I'd like to look into that and really get you some up-to-date evidence. So if I can grab your email, Chris, I can get that to you after the presentation. There's a good question there about eggs and other nuts. So, you know, can you have too much of a good thing? Should we limit eggs? According to the Heart Foundation, we don't need to limit eggs. There was a lot of, you know, bad press for eggs some years ago, unless you've got specific dietary or medical conditions. There's no need to limit eggs. And an infinite amount of nuts. I don't know that it'd be all right to have an infinite amount of anything, but certainly nuts every day in a sort of moderate amount. So a small handful is really healthy, and yeah, nuts every day is completely fine. Having a lot of nuts, you might get some unwanted side effects. Having a lot of high fat food, you can see it in the toilet bowl. So, but certainly a moderate amount of nuts every day is completely fine. All right. Yeah. So question about a vegetarian diet. Absolutely, vegetarian diets can be really nutritionally balanced. I think getting some advice from a dietitian to follow a vegetarian diet is really what I'd recommend, because sometimes people end up cutting out core food groups. So for example, if it was meat or meat alternatives, and then not replacing the nutrients that they would receive there with other things, or, you know, it might be dairy. Sometimes people end up cutting out that whole food group and not replacing it with other nutritious, for example, calcium foods. So it's definitely possible for a vegetarian diet to be adequate and nutritious, but getting some tailored advice, I think I'd always recommend. A couple there about vegetarian and vegan, the same thing for vegan. I think just getting, yeah, getting some advice on that. And there was just one. There's another one about, oh, Chris, that's another question from you. I'm going to take that down, Chris, and we just want to get Chris's contact details somehow. Yep.
I've emailed.
Great, great. So our marketing team, Chris, have emailed you so that we can get onto you. And I think I'm just having a double check over those questions. And I think I've covered them all. So if there isn't anything further, I'll just tell you about our next webinar. It's coming up on Wednesday, the 6th of November with Vari, one of our occupational therapists. So that'll be a really fun and informative session about assistive technology. So I hope you can join us then for that. Thank you again, everyone. I really enjoyed sharing this with you today. Hope you enjoyed it as well and got something out of it, and we'll see you for the next one.